your life.
Okay, hey everyone. So we're here in my apartment, and I just got back like 2 minutes ago, so I just met this woman, so we're going to start totally from scratch. We're here with Dr. Sarah de la Torre, is how you pronounce it, who's one of the founders. She's the medical component of the founders of the vFit, which, as you know, I've been trying out, which is kind of hilarious. And this is the first time we've done like a real FaceTime live interview with an expert, so here we are. So we just met. I asked her right away how old she is because she has unbelievable arms. I'm sorry, but you have crazy arms. She's 47. And so just, I don't know, tell me how this happened. Like okay. You're a doctor with a medical practice in Seattle.
Yeah.
So like you're a regular OBGYN.
I'm a generalist, an OBGYN.
Do you deliver babies?
I've delivered like 3,000 babies. I take care of women, as all OBGYNs do, from puberty sometimes, but mainly college age, all the way through. My oldest patient is 85.
Okay.
So one of those journeys.
Where'd you go to medical school?
I'm from New Mexico, and I went to medical school at the University of New Mexico, and then went to University of Washington for residency.
Nice.
And I stayed.
Do you have kids?
I have 3 boys. They are 9, 11, and almost 14.
Okay, so they're younger. I always find it really funny when I meet wolfers. I mean, the typical age is like 54 in the group. So it feels like sometimes everyone has kids who are like 19, 20, 22, like my kids' age. So you're a little younger, which is cool.
Yeah.
All right, so how did you come to, how long has this been in development? How long have you been involved?
I've been involved for about 4 years. So Colette Cordian is the CEO. She's an amazing woman. She was in the medical aesthetics business for about, 20 years.
So mostly face?
Face. She had a medical aesthetics business, and then she's owned a couple different companies. She's sort of a serial entrepreneur. And she was getting ready to have a baby. And she thought, all of her girlfriends started telling her all these horrifying
your vagina would be ruined for life.
She would try all these things. And so she started thinking, well, we use lasers on the face. We use red light on the face. Why not try it in the vagina?
Yeah.
And she developed this product, and she got me on board early on, because I was very excited to be able to talk to women about an option, because there aren't.
Well, I have to say, that makes me happy, because that's the way I've been thinking about it, is like, I'm honestly a little skeptical, like, is this really going to do much for my vagina? But it does, I'm looking at it like that, like I spend money to do shit on my face all the time, whether it works or not, I don't really know, and I might as well try this.
I think that's an excellent point, because we do spend a lot of money on our faces, or someone says, oh, do the whatever facial, or do this, and we try it, and we think, I don't know, did it work or not? We pay a lot of attention to what people can see, but your vagina is very important, as you know, and as you age, it does start to do similar changes that our skin does. Elasticity and all that.
Actually, one of the things that on the podcast that Hillary and I do when we interviewed, my gynecologist in New York is this woman named Laura Corio, who I adore, and we interviewed her for an episode on dry vagina, on vaginal atrophy, and she basically kind of, the moment that really will stick with me forever is she says, when you're young, the inside of your vagina is pink, and as you get old, it's gray. It starts to kind of
and it's plump when you're younger, and then it gets thinner. You can definitely see a visual difference on pelvic exams, absolutely.
Yeah. I first actually was diagnosed with vaginal atrophy when I think I was like 41, and I had a uterine polyp, and so I had surgery, and I got the pathology report, and of course you're worried, like, do you have cancer? And the pathology report said benign, but then it said atrophic vagina, and I was like, what do you mean? like, how dare you? I was like, I was so offended.
How dare you write that
down?
I
asked my doctor, and she was like, oh, that's standard. You're 40, or you're 40 whatever. Your vagina's going to atrophy. That's just what happens. I was like, okay. All right, so in the thread, I've already talked about how we use it, but I guess I could show you guys online, because I guess we haven't done that. So, basically, you push the power button, then you push this light button, and I've been doing it for the max, which I think is 10 minutes or 12 minutes, and then you push this again. Oh, fuck. Oh, there you go. And it lights up. And then you put a little bit of lube. It comes with this phototonic gel.
This is a great lube because it has hyaluronic acid in it and aloe, and it helps kind of promote the optic properties of the lube. Any lube will work, but we think this one is better.
Yeah, the hyaluronic acid is the stuff that also we put on our face, right? So you put a little bit of this on here, and then you just stick it in, and then there's that really, have you seen the funny picture of me using it?
No.
I have to show it to you. It's on my phone, so I'll show it to you later, but there's this hilarious picture, because of course you put it in, and then there's this like red light emanating from your your vagina.
Right.
And basically what I've been doing is I stick it in and I literally just FaceTime for 10 minutes. Like it kind of holds.
Yeah,
it's pretty big. It just holds itself in and I'm like sitting in bed. And so I just FaceTime or do whatever. And I do it for 10 or 12 minutes and then I just turn it off.
Can I show you something?
Yeah.
So what is good to know or look at is these lights, if you can tell, are super bright. And when you put your hand around it, it's penetrating through my skin. So the way it works in terms of the technology is photobiomodulation gets the light, the photons get absorbed by something called mitochondria in our cells, and then it produces different, ATP and cytochrome C oxidase, all these technical, scientific things. But basically, what it causes is some vasodilation. So that's the blood vessels.
The blood vessels
opening
are
up,
stimulated.
and then it causes different things in your body are called in to reduce inflammation and increase cell proliferation, which is more cell production.
Yeah, which is like more things in your when you do it your
and we think collagen is what is actually being produced. That's what's shown in the studies. And then more blood flow. So blood vessels come about. And I can show you a picture at some point of like a menopausal vagina on a biopsy, and then after you use it, it's increased in thickness.
After you use this. So the blood flow thing, right? They say like it's better to masturbate, or like if you're not having sex and you're our age and you don't want things to dry up. So the whole idea of blood flow is like anything you're doing to stimulate is going to increase blood flow, right? But this does it more.
This does it in a way that the blood vessels stay. So if you're masturbating or you're having sex, you have blood flow to the vagina. But if you don't have as many blood vessels there anymore because of the changes that happen without estrogen, this is promoting angiogenesis, the formation of blood vessels, and we see it on biopsy.
Okay, so that brings up one of my questions, and I have a list of questions to ask. Okay. So one of them that someone asked, I think Elise Pettis recently said, so right now I've agreed with you guys to use this for 3 months and kind of see how I feel. But then is the average person supposed to just use it forever? And like how often? Like if you because I was using an S string, so my symptoms, mostly my biggest symptom has been that urge to pee thing at night. So it's like a bladder thing. I had one incidence of painful sex when I was like 47. It scared the shit out of me. And I went and got a strace. And then I used it kind of erratically, but I've never had painful sex since then. So, but with the peeing issue, which is really a nightmare, where like suddenly at night I have to pee all the time, I had to go back and so then I went on the S string for a while, which I liked, except my breasts got really big, but that may just be because I've gained 10 pounds and I'm fat, not sure, but I felt like maybe it was estrogen. And then I went on so now I have a prescription for Vagifem. The estrase was too goofy. It's gross. Like you have to wear a liner. And you can't have oral sex. Like if you use it for like 2 days, you feel like you're poisoning someone. So anyway, so those are my symptoms. So for this experiment, I've stopped everything. I'm just going to use this for 3 months and see what happens. And I'm like in like 2 weeks in. But so then is it like a lifetime commitment? Like how often do you use it?
So we would suggest to use it every other day. For what I tell my patients is every other day for 10 minutes or 12 if you want to do the max. And then after 70% of women see a difference by 30 days. And then the remainder by 60 days. After 60 days, you're pretty much where you're going to be, we think. It's a new product, but that's what we think. That's what women are telling me. Because I got to 60 days, it felt good. And then I say just once a week after that. Because because you do need to do maintenance treatments. Because like Botox, like anything, the tissue goes back to.
So then if you're doing it, so I do it for 30 days, then I start doing it once a week. Then I really just never have to use Vagifem in theory or Estrace or anything again?
If it's maintaining your symptoms, And so I was really excited for women who've had breast cancer who can't use estrogens or feel concerned that they're using estrogens. Should hopefully be a great solution for them.
I know, my mother died of breast cancer at 46, so I'm not on bioidenticals. I was briefly, but anyway, I'm not on hormone therapy. And of course, they say with these vaginal things, they're just topical. I don't understand that. Like, they do go through the bloodstream. They have to.
And it depends on your oncologist. In Seattle, most of the oncologists that I work with are comfortable with the S string, but not with Estrace and not with, sometimes with Vagifem, but depending on the dose.
Oh, so that's so interesting. I mean, that's one of the biggest frustrations about the whole menopause thing is like, I mean, maybe it's all medical stuff, but you get such different stories. I mean, like my gynecologist, who I adore, says it's totally fine to use any of these vaginal products
Even with the history of breast cancer?
Yeah.
Oh, that's so interesting. Yeah, I agree.
And then if you were in like Europe, you'd get a different story. Like my daughter's having a health crisis in Europe right now, and they don't agree with the American doctors at all. It's just so frustrating. But okay, so that's cool to know. So
yeah, and then this device will last 2 years.
oh, really? What happens to it after 2 years?
Well, I don't know what happens to it after 2 years, but it's guaranteed for 2 years.
Oh, so if I have a problem with it, I can exchange it.
You'd have to ask Colette that.
Okay.
Yeah.
All right, so let me look at people's questions. And are
Yeah.
we getting any on FaceTime? I should check on this is kind of meta. We're not. Okay. So
we have what is the device? People who are tuning in late, maybe do a recap.
oh, well, okay, so if you're tuning in late, this is the vFit. It's made by the company's called Joylux, right?
Mm-hmm.
And Dr. Sarah is one of the founders. She's a medical doctor.
So I'm going to correct you there. I'm
Yeah.
actually not one of the founders.
Oh, okay.
So
You're a consultant.
I'm a consultant, and I prescribe it to my patients in my practice when appropriate. And so this device is not, it's not a medical device.
Right.
It's a wellness, it's an intimate wellness device. And so it helps, what patients have told me is that it helps with their dryness and with bladder issues and just sort of general pelvic floor health.
General wellness.
Mhm.
Okay. Is it recommended for use after symptoms start appearing, or can it be used as a preventative?
Absolutely.
Preventative.
Mhm.
Yeah.
Yeah. But it does work if you have symptoms.
Right. Right.
Yeah.
Okay. What's the difference between this and the Mona Lisa Touch? So the difference between LED and lasers
Right.
in general.
Yeah, so that's a really good question and can be somewhat confusing. So LED lights, the photons sort of go in they disperse as opposed to the lasers at pinpoint. They're all focused in. The Mona Lisa Touch is, what it does is it actually causes thermal damage to the tissue. Kind of again, like when we have lasers to our faces and and you look bad for a while, you damage the tissue, but then with the repair, it's supposed to regenerate collagen.
It's just like
right.
a laser.
So this is not damaging the tissue. It's activating the cells with the photons and just doing the regeneration part.
So what's the equivalent for facial stuff?
So they have red lights
They do
for
red light?
facial, for hair regrowth. There's these
Okay.
laser caps. They're LED
Oh yeah,
light
I've heard
caps
about those, yeah.
that have. There's good data with that. There's over
Okay.
honestly 3,000 clinical studies about LEDs for wound healing, for pain management,
Mm-hmm.
and for hair regrowth, and now vagina.
Okay, so it's a slightly less intensive treatment. That's why the Mona Lisa is a medical procedure, and this is a wellness device.
Right.
Okay.
And so for women who don't want to pay $3,000 to $5,000 for the Mona Lisa, who want to do something at home,
Right.
who aren't sure what they want to invest that much, because with the Mona Lisa, you do have to go back every year.
I think of it as like, that Clarisonic that people
Yeah,
use
that's
on their
exactly-
face?
yeah.
It's a little bit like that.
Right,
Like that.
it's like that.
How much is that gizmo? Like $150
Yeah.
maybe? So this is like a slightly fancier, but it's the same idea.
Right, same idea.
Okay. Does the device help with incontinence and/or improve lower abdominal muscles?
So the device is not, again, it's not a medical device. So what I can speak to is what patients have told me. And I've done some survey data with patients. We've done other clinical trials that are randomized and not published. That data is coming out. But the survey research that women did see a decrease in their bladder leakage. And they did see improved vaginal dryness, improved orgasms, I think probably because of the blood flow.
That's the thing I'm wondering if I'm.
Yeah, I think it should be,
Yeah.
yeah.
But not improve lower abdominal muscles. That seems like
No,
a
I think
stretch.
you have to
go to the gym for
You have
that.
to work on, go to Pilates.
You have to go to Pilates.
Which of course will help your pelvic floor. But
How is this device different from an electronic Kegel device? Example, the Joy-On.
So I have not used an electronic Kegel device, but I can imagine what it is, and there's lots of ones.
I used one very briefly. The LV, I think it was called. It was just too much work. But
Okay, so this is not stimulating muscle contraction.
okay.
I do tell my patients to do Kegels. What's
Yeah.
it in there? Because then you're already there. You're already
Oh, while you're doing it?
yeah. Because then you're increasing your pelvic floor strength. Kegels are really hard for women to do. I think they don't.
We have a hilarious recurring thing. There's actually a woman named Amy Capon who I've known forever who's in the group. And so every once in a while, she started it. We'll just post Kegel to remind people to Kegel.
do it. Yeah, I know. I tell women like do it in your car and at the stoplight.
We had this really funny thread where women were like, how do you remember to do Kegel? And some women were like, I do it whenever I'm in an elevator. And someone was like, I do it 3 times when I'm peeing. And like, there were all these like funny.
Right. Yeah. And so I just tell women, do your Kegels
while you're doing it.
Yeah, because then you are actually, because the problem with Kegels for a lot of women is they don't, it's hard to know if you're engaging the right muscles, but if you're squeezing your vagina around something, then you can tell if you're, and then if it lifts up, because you have the strength to lift it up, then you know you're using the right muscles.
Wait, you can have this and see it lift? You have she has very strong arms and a very strong vagina. I don't know that I could lift this with my Kegels, but I'll try.
I bet you can get it up.
Does it help vaginal tissue regain elasticity? Yes.
That is what patients are saying.
Okay.
Yeah. One woman put a review yesterday that I was looking at that she's 65. She thought her sex life was gone forever. She uses and she just feels she's not having sex. She has lubrication. Yeah. There's a lot of those reviews on the website. I was just looking at it yesterday.
That's awesome. All right. How long will the results last? Well, we talked about that. So it's ongoing. You just keep using it.
You have
refreshing. And should you expect to be using vFit indefinitely? Yes. Okay, we answered that question already. So my plan is to use it for every other day for 30 to 45 days. I've gotten both.
I would use it, since you had said 3 months, I would use it every other day for the max for 60 days.
Okay.
And then let me know how.
Okay.
I'm really curious.
Yeah, and then I'll go on a once a week. I'll say it.
Maintenance, yeah.
Okay, so the last question I have is kind of silly, but honestly, it's very pleasant using this thing, right?
Well, that's part of the reason why we made
It's
Colette made it
pretty
vibrate, is so it feels good.
Oh, so
you
the
use it.
vibration's not particularly
No, there's a little bit of
necessary.
data about vibration and it affecting fibroblasts. There's not a lot of, I don't think the vibration does anything. It's one study that I read that
So it's the
maybe
heat and the light.
it's the light.
It's the light.
The heat causes, temporary vasodilation, like when you get warm, you get in the hot tub, your blood vessels, but it's the light.
It's the light. Oh,
It's
that's
the
so
light.
interesting. Okay.
But the heat and the vibration feel good.
Recap how I use it? Okay. Sorry, Sydney's telling me to recap how I use it, so I will. Although it has a lockout feature. Hopefully I can get it started again. But so it's interesting about the heat and the light because, the heat and the vibration, because that is what makes it super pleasant. Like, it's not totally like you feel like you're using a sex toy, but I have to say, I've masturbated a few times after using it. Like, it is very...
Well, it should. Well, the other thing is, so we did do a clinical trial of 55 women on a similar device, and I interviewed each one afterwards, and they also said that it increased their libido, and I think it's because they started thinking about sex more, like they use it and you won't lose it, kind of an idea, and it feels good, so you're like, oh, maybe I do want sex. Yeah.
No, because it is a huge issue, the use it or lose it thing, and there are a lot of women who either aren't having sex because there's just not someone in their life right now, or
it hurts.
and the dryness, or it hurts. So
or lots of reasons.
So I'm going to recap one more time how to use it since I haven't done that. This is the first time we're doing it. So basically, it looks like a dildo or a vibrator, and there's a power button. Okay, and then this one green light lights up, and then I pick my time, and I pick the max amount of time because it's fun, and then I push this again, and then it lights up, and then you put a little bit of lube, this special hyaluronic lube with aloe. You put a little on, and then you put it in, and then this button actually, this is the one that increases vibration.
It can change. There's like 10 different vibration modes.
So 10
whatever
different
feels
vibration
good
modes.
to you. It can pulse. It can stay steady.
Got it.
Yeah.
And that's the part that apparently I just learned. It's just been added really for fun. And I just insert it, and then I honestly just go on Facebook with my phone, or whatever, talk on the phone or whatever, for 10 minutes. But it is, it's just cool looking, but it really is kind of fun. I think my biggest concern now, which Sarah's just answered, is I was kind of thinking, well, am I committing to doing this forever? Because I don't know that I want to do this every other day. But that's not what I have to do, apparently. Apparently I have to use it every other day for a couple months, and then only once a week for 10 minutes.
Yeah, and you'll figure out your maintenance if you say, it's kind of like with the estrogen. You have to use it twice a week over time.
And I was using it more like as little as possible, and that was working for me. So
so
you
figure
out
out where your threshold is that you're getting the results that you want.
Trying to think if I have any other questions. I don't really think so. I think, Muffin, you're distracting me, sweetie. Is there anything we haven't covered that you want to add?
No, I just really have.
Are you getting? Oh, I know. Another question is: are you getting like resistance to it? Like, is there any downside?
No, so it's very safe. Again, those 3,000 clinical data, 3,000 studies on LED lights in general. It's a safe. So it's been around since the 60s.
Right, because originally, actually, so I didn't know this company, and they contacted me, I don't know, in August, and sent me one of these. And I was really busy and distracted, and I was like, I'm not going to put a hot thing in my vagina. Like, I don't know who you are. And then when we finally spoke to Heather, then I called my doctor and asked, and she was like, it's totally fine. And so now I'm trying it.
Yeah, it's safe, and it's just, my experience has been with the clinical research I'm doing, and then with what patients are saying, is that it is working for the majority of patients.
And is there competition?
No, we are the first and only LED device that is on the market.
But there are probably others coming.
Probably.
Have you seen this? Someone sent us this crazy book. It's somewhere behind Sydney, but it's about vagipreneurs and the growing business.
Fintech is the other thing. It's like women's health.
Yeah. So I would imagine there are others coming, and I wonder what they'll do differently.
Yeah, I don't know. We have a patent. Colette has a patent, and on the technology. So I don't know what people do differently.
All right. Well, thank you.
Yes,
this is totally fun. Answered all my questions. I'm psyched. All right. Bye, everyone. Take care.